Dr. Singa, how are you doing today?
Doing well, thank you. Thanks, Josh.
I just want to first thank you for sitting down with us today in hopes of educating your patients more about Omnia SI Fusion and kind of the benefits and how it can help them with their pain.
Yeah, of course. Looking forward to it.
Perfect. So first I'll introduce myself. I am Josh Valladon. I am a medical device consultant for Omnia Medical. We are a medical device company primarily for spinal hardware, but we actually did our first posterior SI joint fusion in March of 2014. So we've been around for about 6 years in regards to this space. And we've had a lot of success both locally and nationally. Also had a lot of success with Dr. Singh as well. So I kind of want to ask you a couple questions, but first you tell the audience a little about yourself.
Sure. My name is Ramesh Singa. I was really trained as an anesthesiologist and then was trained in a pain fellowship. And so I'm an interventionally based pain physician and was able to learn through Josh of the Omnia procedure and the device itself, and was easily trained on it, and we were certainly able to help a lot of patients in the past few years.
Awesome. Well, thank you. So if you don't mind, I'll ask you a couple questions and attempt to better educate your patients. First off, back pain. Kind of what are some symptoms of back pains and what leads them to the SI joint dysfunction?
Well, there certainly is kind of a common entity, back pain. However, the distinction can be made by us as to what's causing the back pain, because not all back pain is the same. It can be caused by disc degeneration, compression fractures, arthritis of the spine, and of course sacroiliac joint arthritis or dysfunction. And so, since we're talking about Omnia today, that sacroiliac joint dysfunction is what we're concerned about. And it's about 15% of back pain is actually caused by that, which is a significant number, because when people think of back pain, they think of getting an epidural, and they'll say, well, that back injection didn't work. But there are, and I'm sure we'll talk about it in a few minutes, but that should be a distinguishing thing, is that not all back pain is needing an epidural, and certainly the sacroiliac joint would be a different type of injection, and we'll get to that.
When speaking about SI joint dysfunction, can you kind of give me the causes, what may lead a patient to have pain from the SI joint?
Yeah, of course. So most of the arthritis that may happen in the joint is due to genetics, about 70%. The other parts can be from trauma, motor vehicle accidents, can be from childbirth, so pregnancy, and of course from different types of occupations or sports.
Okay. And let's just say a patient comes into you for the first time, or even multiple times. How would you diagnose SI joint dysfunction?
So initially the symptoms, so symptoms of sacroiliac joint dysfunction may be pain in the back. It may radiate down into the groin. It may also radiate down the thigh. It may also radiate down into the buttocks. Okay. So there are several different variety of ways that can present. But based on symptoms first, and then we do an examination, which usually involves manipulating the leg and palpating the back. So there are different tests such as a Patrick's test or the Faber test, compression, distraction, etc. And then once we do that, we usually may look at some imaging, but we can generally diagnose sacroiliac joint dysfunction by examination. Okay. And then we proceed with interventional blocks.
Awesome. And I think we both can agree that this procedure is pretty minimally invasive, but is there any other conservative treatments that you might try prior to just going to the fusion?
Correct. So generally, even before going to the fusion, we'll require the need to do 2 sacroiliac joint injections. They may be with or without steroid, usually using a medication like Novocaine. They'll be injected into the joint. We use live x-ray, numb the skin, put a very tiny needle into the joint, and inject either just Novocaine itself or steroid. And if there is relief, then we can attribute that most likely the pain was from sacroiliac joint dysfunction. And if we do want to proceed to the Omnia fusion, then we want to do 2 of those blocks to confirm, and then the patient becomes eligible to get the fusion. However, if we want to perhaps do some other procedures or other maybe therapies before that, then we would do physical therapy. We consider doing a repeat of injection of steroid. We would also consider giving medications, whether oral or topical, prior. There's also a procedure called the radiofrequency ablation, which is a stunning of the nerves that innervate the joint, which may last for about 6 months and can be repeated.
Awesome. Well, the one question that usually all the patients ask me is the procedure. What does it involve? What does it look like? Can you help the patients understand a little more about the actual procedure itself?
Yeah, of course. So first, it's minimally invasive, meaning that there is a 1-inch incision made. We do it under live x-ray, so that's very safe. And second of all, patients come in and they takes about 20 minutes to do. So the rest of the 40 minutes is recovery from anesthesia, getting the IV, etc. And the patient leaves. So it's all outpatient. And generally, there really is no recovery because the patient walks out. Unlike some of the more invasive sacroiliac joint fusions that may require several weeks of recovery, this is immediate. Usually patients can either use some ice to treat the surgical site or maybe prescribe some oral medications, but generally it's a very quick recovery.
Awesome. Well, first I want to thank you for this discussion. I also want to thank you for the patients you've already treated with this device. I think we both can agree it's been doing pretty darn well for them, and I look forward to continue working with you and hopefully helping more patients out there as well.
Thank you, Josh.
Have a great day, Doctor. Thank you.
Thank you.